Okay, our second group of adjustments will begin with what we call a regular grip pull, all right? And this is a double web contact on our hands that we're going to use. Usually we do this from the head of the table. In some instances we can use a footrest to perform this. So I would step to the head of the table, adjust our headpiece accordingly, make my regular grip. I start out in a toggle stance, I step back to a two-line, and then the impulse becomes a double arm side slap. This is to create long axis traction to separate a joint along its long axis. And as the second one we'll do in this series, the Duke Scoop, the double ulnar knife edge contact, is a similar type action. We can perform this from the head of the table, mid-table. Various stances can be used: standing, one line, two line, kneeling. But we would palpate, make our double ulnar knife edge contact, and then it's a double arm side slap. The difference between the regular grip and the Duke Scoop is that with the Duke Scoop we are trying to create a shearing action. And we use this characteristically on large joints such as the shoulder, the elbow, the hip, and the knee. As we step back, we can also do what's called a Pisiform on thumb. So our thumbnail becomes our target, and we place a Pisiform over that. So what I would do, I can do this from the head of the table, palpate thumb, contact Pisiform on thumb, I wrap my hand, and then my impulse is what's called a sustained toggle. So it's a toggle and hold. Note that you cannot see my thumbnail, all right? I look for that. We do not want to see a person's thumbnail, and the force drives right through the thumbnail. This adjustment is used on small bones such as the tarsals in the foot, the carpals in the wrist, the AC joint, the SC joint. Works very well for those. Back to the spine. With the table, we can do, first of all, what's called a cross Pisiform at 90 degrees. I stand in a toggle stance. I can make a bilateral palpation. I am on the same segment. My superior hand goes contralateral. My inferior hand goes ipsilateral. They are at 90 degrees to each other. I lean forward and then use an upper body drop where I bend from the waist. Or, if I move my knees back from the table, I can perform the same movement and just do a lower body drop, where I kick out with my legs. The setup for the cross Pisiform at 90 degrees. This is a very commonly used thoracic spine adjustment. We make a bilateral palpation on the same segment of the thoracic vertebra. Superior goes contralateral. Inferior goes ipsilateral, episternal notch is directly over the contact, upper body drop or lower body drop. Our next one, cross Pisiform butterfly, is performed from a one-line stance. So I always tell people, point at your feet, point at the table, and that will give this offset palpation pattern. So my superior hand is going to go contralateral, transverse process. My inferior hand swings over the top, that squares my shoulders, and then it becomes a forward body drop. Line of drive becomes 90 degrees to the segment, or a straight P to A. Okay, we set up on this. Patient would be prone. Point at my feet, point at the spinous transverse processes of adjacent segments. My superior hand is going to go contralateral. My inferior hand is going to swing over the top. I'm going to square myself and forward body drop. Again, probably best used T5, 6, 7, 8 area. The final one in this segment is what we call Fists of Fury. And this is the Keck maneuver, which we'll eventually get to. So this is where I'm going to make a bilateral fist recoil using knuckles 2 and 3 on both hands. I make a bilateral palpation, contact, and then perform a toggle recoil using both hands. So it's palpate, contact, square, adjust. The setup for this adjustment on the spine, we would elevate the table because we want to bring the neck into slight extension. Now, I would use my radial knife edge, bilateral radial knife edge, and I'm going to contact the articular pillars of the segment that I'm choosing. Ordinarily, we'd have a drop headpiece here. I would set the headpiece, slide into place, and then give a sustained toggle impulse on the spine. So on the speeder, we'll use a toggle recoil, but on the spine, we'll go to a sustained toggle. And that ends our third section.